Good afternoon. Thank you for joining us. A new lawsuit over MAID is renewing debate around publicly funded hospitals and faith-based policies. It's from the family of a woman who had to move from St. Paul's Hospital to receive medical assistance in dying. We'll hear what the province had to say this morning and from a healthcare ethicist. After 12:30, social connection is vital to our well-being, but do you find it hard to make friends in Vancouver or other parts of BC? Let us know. I'm Michelle Elliott. Welcome to BC Today. And you can call us now on our top story. Should publicly funded hospitals be able to refuse services based on religious ground? That's our question. And you can dial us up, 1-800-825-5950, 604-669-3733, or you can hit pound 690 on your cell phone. You can also email bctoday@cbc.ca. The family of Samantha O'Neill is suing the province and Providence Health Care, saying the policy to ban MAID at its facilities violates patients' charter rights. In April of 2023, O'Neill opted for end-of-life care after being diagnosed with stage 4 cervical cancer. She was being treated at St. Paul's Hospital, but couldn't have MAID there because the hospital is run by Providence, which is a Catholic health organization that opposes the practice. Her family says O'Neill suffered physically and psychologically. Now, for its part, Providence Health Care says it's reviewing the court filing to determine the next steps and is committed to providing compassionate care to all patients and residents. It states, as we are a Catholic healthcare provider, MAID is not available at our facilities. Consistent with BC's regulations, Providence works closely with Vancouver Coastal Health to ensure patient requests for MAID are addressed in a timely and healthy manner. Health Minister Adrian Dix was asked about this case this morning in Surrey.
We very much respect everyone's right to go to court and make their case there, and very much respect everyone involved in this process. MAID is a legal end-of-life choice in British Columbia. It's strictly regulated, but it's a legal end-of-life choice, and it's our job to ensure that people have access to MAID in our province. With respect, for example, to St. Paul's Hospital, we are offering adjacent to the hospital, essentially on-site. Vancouver Coastal Health will be, is organizing and building that. Hospice care, end-of-life care on that site in order to ensure that everyone has access on that site without going somewhere else to MAID.
That space is expected to run this fall. Now, Daphne Gilbert is a law professor at the University of Ottawa, and she spoke to the Early Edition this morning. She is part of the legal team supporting the O'Neill family in this case. She's also vice chair of an organization called Dying with Dignity Canada.
Given that the source of their funding comes from that multicultural, diverse society, to me, it is unacceptable that they continue to discriminate on the basis of religion, and that is often the case. That either your specialty doctor is at the faith-based hospital, or it's the only one with an available bed, or it's the closest hospital. I think we have to understand that people maybe need to think about the extent to which they want to have other people's religious values dictating what kind of care they're going to receive.
We're asking you once again, do you think publicly funded health facilities should be able to refuse services based on religious grounds? Our numbers again, 604-669-3733 or 1-800-825-5950. You can also hit pound 690 on your cell phone. If you'd like to email us, it's bctoday@cbc.ca. And we should also say at the start of this conversation that none of the allegations have been proven in court. My guest for this discussion is Sally Thorne, Professor Emeritus at UBC School of Nursing and specializes in healthcare ethics. And she joins me here in studio. Very good to have you. Thank you.
Thank you so much, Michelle.
How difficult is this issue to tackle?
It's a very difficult issue for a whole bunch of reasons, one of which is that conscientious objection was built into the early anticipated implementation of the legislation. And everybody understood that an individual could conscientiously object, but it was not understood that an organization could have a conscience and object in that manner.
Tell us more about that. So, what is the legislation that allows a health authority like Providence to operate under public funds, but to, in a way, have its own rules when it comes to something like MAID?
I don't think it's ever been fully resolved, and some hope that that's what this court case will allow, some further discussion and some real debate to be able to settle it fully. All of our provinces, including BC, have moved really far with regard to individual conscientious objection. So if a physician, for example, does not feel comfortable providing MAID, that individual has to make very sure that the patient has had appropriate and full access to someone who will support them in that journey. So we've worked a long way in that regard, but we haven't quite tackled the idea of faith-based institutions in general. And I don't think the government has really been wanting to tackle them directly, partly because historically, the faith-based groups have provided a lot of hospice and palliative care services in this province. So it's a combination of funding, and I think we would be in some difficulty if they were suddenly to withdraw that funding.
Well, that's it, right? That question of being publicly funded, how much does that make a healthcare provider, an organization, more accountable or more compelled to abide by what is a legal choice?
It's important, I think, to distinguish healthcare professionals from the organizations in which they work.
Yes, and this is the dilemma.
Because many nurses and physicians and nurse practitioners who are involved with faith-based institutions of various kinds don't hold those same views. But as employees or having an affiliation with those organizations, they are bound by their rules. I think it's useful to understand that since 2016, when this legislation came into being, most of those institutions have moved very, very far. In 2016, one wasn't allowed to raise the question of MAID with a patient or answer a question. They've moved very far to be providing the extent that they can right up until the moment of that transfer. So we have moved a great deal, and we're now at a point where for the most part, the only piece that's not been resolved is that actual moment of provision. And that's what's caused the forced transfer or the creative arrangements to say, let's create a wing or a unit that isn't Providence, but is Vancouver Coastal.
And the argument in this lawsuit is about, that forced transfer, that causes psychological damage, psychological suffering, and physical suffering. How much of a workaround is that? Is it acceptable?
I think that because of the care and concern that so many health professionals have had for the well-being of patients, these are their patients, and these are hospice and palliative care specialists. They truly understand the dying process. And in most instances, I think it's probably fair to say they have done their utmost to make sure those transitions are smooth, that people aren't abandoned, that the staff from the institution may accompany them to that point. In many times, it will work appropriately, and it's an inconvenience for sure to not be in the bed that you have come to know as your home. But most people manage it very well. I think, though, as this court case demonstrates, there have been cases in which it's intolerably inhumane, and the agony for the patient and what the family are left with is not acceptable.
There was a doctor who spoke on the Coast yesterday who is part of this suit, and I would imagine that would be her argument, that it goes far beyond inconvenience.
Yes.
It was part of what she talked about on the program. We're taking calls from our audience on this too. What do you make of this case, and what do you think about publicly funded healthcare institutions, and to what extent they can impose or abide by their own faith-based policies, and can they refuse services based on religious ground? We're taking your calls on this. 1-800-825-5950, 604-669-3733. You can hit pound 690 as well. And email is bctoday@cbc.ca. And Hannah writes us, a publicly funded hospital should not be able to refuse a medical service such as MAID. Thank you very much for that. And, I should also mention that we reached out to the Archdiocese of Vancouver. We haven't heard back, but they did make a statement on MAID from late last year. This was by the Canadian Conference of Catholic Bishops, reiterating that it unanimously and unequivocally opposed the performance of either euthanasia or assisted suicide or MAID within health organizations with a Catholic identity. So that was a statement in November 2023 from the Canadian Conference of Catholic Bishops. Let's take a call now. And Chris is on the line from Burnaby. Hi, Chris.
Yeah, hi. I'm wondering about freedom of association, like as a person who has been a patient or is taking elderly, frail people into the hospital, I don't want to be treated by people who provide MAID. And I wouldn't want to be in a room associating closely with people who are receiving that. It's very distressing going into a hospital with especially somebody who is elderly or frail or whatever, thinking that the person you're speaking to, who's providing you services, might be offering or asking that person if they want MAID or providing that. Simply don't want to associate with that, and having forced association with that is a concern for freedom of association, a charter right.
And so in that sense, then, in this particular context, you would say being at a hospital, a facility like St. Paul's would be something you would look for?
Yeah.
Okay. Chris, thank you very much for that. Yes, what do you make of her argument there?
I think this is a very complex situation, as Chris's comments suggest. There are people in Canada who would object to going into a typical publicly funded hospital because the practitioners they were working with would approve or have been involved in that service. However, it is a legally funded service in this country. A lot of work has been done to establish that. Regularly, public opinion poll shows that Canadians are increasingly in favor of this practice. So it is very difficult. If you're not going into a faith-based institution that is prohibiting it, you will potentially have contact. And I think typically patients can't necessarily know what the values and views are of the individual healthcare professionals they encounter. But what they can be assured of is that everyone does their best to try and provide safe and comfortable care, including emotionally and psychologically safe and comfortable care for all patients.
That is, a concern that I've observed and have heard from groups and advocates for people with disabilities as well. And there is strong opposition there to MAID. So, I've asked you, how difficult is this issue? Is it a case of basically balancing rights of various groups and perspectives of various groups here?
Absolutely, and it absolutely requires that relational care in which people talk about issues, sort out what values are in play. That on the one hand, we do a disservice to patients if we don't raise the idea of the legally available options to them if they're facing end of life. What we know, what nurses have certainly learned early on, was if you wait for the patient to raise that, then it is only those who have privilege in society that are likely to raise it. The small silent voices tend not to raise that question so easily. So nurses have had to learn to be quite creative and thoughtful to get to know the individual and to raise vague questions like, are you interested in having conversations about the options available to you? Which of those conversations would you like to have? So I think that's a much more comfortable way to begin a conversation. No one is going to in any way encourage or counsel toward MAID.
That's the concern, isn't it?
Absolutely.
We have an email here as well from Lisa, who writes, I'm adamantly against these hospitals that dictate what can be done with public funds. Taking your calls again, asking you, what do you make of this case? And do you think that publicly funded healthcare facilities should be able to refuse some services like MAID over religious grounds? You can call us 1-800-825-5950, 604-669-3733. Bernita is up next in Langley. Hi, Bernita. What do you think of this?
I'm in healthcare, and I think that the MAID program is wonderful. My father actually had MAID done about 5 years ago, and it was a really good day for our family, you know, to be able to respect his wishes. He did that at home. Had he landed in a facility that didn't allow it, I think that would have been really hard on our family and on him. Also, because I'm in healthcare, I've seen people moved at end of life, say to a hospice, and it's very, very hard on them. Sometimes they may only, survive for a few hours after a terrible move like that. Because they're just so close to end of life. So the thought of moving patients out of a care facility to facilitate MAID just doesn't seem practical to me. The host had said maybe having a unit that actually allows it at St. Paul's. Maybe that could be the answer, but I hope it all works out well, and because it is a really good program when people choose for that, you know.
Bernita, thank you very much for your call. I'm sorry for the loss of your father.
Okay, thank you so much.
Take
Bye
care.
now.
That's Bernita in Langley. Yeah, what are your thoughts on that too?
I too can certainly feel for that experience and your ability to imagine what it might have been like had you not had that support at home. To be fair, for anyone who has a family member, a loved one, or who is in healthcare and understands the dying process, the end of life is an incredibly delicate time. And it should not, those last hours should not be spent focused on the logistics of a transfer. They should be spent on spending quality time with family, having those last conversations. And one of the things that Canadians have valued in choosing MAID is that it can allow them to orchestrate that end of life in a way that they feel comfortable and that they feel they're leaving their family with those same kinds of memories, those positive memories that they've exerted a choice that is their legal right to MAID, and that they've died with that sense of autonomy that they've probably lived their lives with.
We're taking your calls on this. Again, it's 1-800-825-5950, 604-669-3733. It's 12:23 now, Pacific time. And as you've been hearing, there is a new lawsuit that's been launched against the province and against Providence Health Care. This is over its MAID policies at that healthcare authority, and it bans MAID at its facilities. But the argument from the lawsuit is that that policy violates patients' charter rights. And this is the case of Samantha O'Neill, who died last year. We are taking your emails on this as well. bctoday@cbc.ca is our email address. And Doug writes, if you're uncomfortable with the publicly provided healthcare offered by our publicly funded hospitals, you can go to a private hospital. Public funding means public policy. Okay, Doug, thank you very much for that. Our email address again is bctoday@cbc.ca. And do stay tuned after 12:30 as well. We're going to take your calls on an entirely different topic. We have the author of a book on social connections joining us, and she argues that it really is vital to our health to establish social connections, but it can be hard. So she has some tips to share, and we're asking you as well, do you find it difficult to find friends or make friends in Vancouver or another part of BC? We'll take your calls on that right after the CBC News. taking your calls on a story that broke yesterday. The family of a Vancouver woman who was forced to transfer hospitals before she could receive medical assistance in dying is suing the province of BC and Providence Health Care, saying that health authorities' policy to ban MAID at its facilities violates patients' charter rights. Now, the case has not been tested in court. What we're hearing from Providence right now is that it is looking at the filing to determine its next steps. And our next caller now is Peggy at Desroches. Hi, Peggy.
Hi,
Hi. And what are your thoughts on this then, on MAID and
I'm
Providence?
all for MAID. I have stage 4 cancer, and I've been fighting cancer for 4 years, and I have been close to the point that I wasn't going to get any better until they found a drug in the States, and it seems to be working. But besides that, I told my children that I want dignity of life before I go, and I want to be able to make sure my kids are well and all that. So, yeah, I'm all for the dignity of life, and I'm for MAID.
Okay. And Peggy, would you find it distressing then, the argument or the policy at a hospital like St. Paul's is there is a policy of transferring patients? Would that be distressing, do you think?
That would the transferring would be it would be very hard because you're already dealing with the cancer and all this stuff, and then all of a sudden you're being transferred. No, I don't agree with that. You should at least have some dignity and be closer to home.
Peggy, thank you so much for your call.
Oh, you're welcome.
Appreciate hearing from you. Patrick is next in Vancouver. Hi, Patrick.
Hey, thanks for taking my call.
Sure thing. And what are your thoughts?
So as I was telling your producer, my father was a recipient of the MAID program back in 2018. And first of all, I just wanted to point out, what happened to the separation of church and state? I think it's fine if a healthcare practitioner doesn't want to provide that service on a personal level, but to have an entire healthcare facility to not participate in that based on religious beliefs, I think is kind of irresponsible. And furthermore, I remember reading a small quote in a pamphlet when my father was going through it that stated, when we look at extending life, we look to science for solutions. But when it comes to ending life, all of a sudden we're playing God, which, it doesn't really make sense.
Patrick, thank you very much. And I'm sorry for the loss of your father.
Solutions.
Thank you. Kelly is our final caller on this today from Victoria. Hi, Kelly.
Hi. Thanks for taking my call. I just wanted to say that I read the story this morning, and I just felt so badly for that poor woman and her family. My mother-in-law was able to have MAID last year, and it was beautiful, and it was her choice. And as the social worker said, it really was empowering for the patient at the end of life. So what I guess I'm feeling about this is I can respect that these people, for their religious beliefs, don't want to provide this, but this is a publicly funded facility, and their religious beliefs should not have an impact on my choice.
Kelly,
Thank
you very much for your call as well. A couple more emails here. Ellie writes, as a humanist, I'm offended that Providence gets an exception when it comes to providing MAID, especially with the expansion of St. Paul's Hospital. The country has a separation of the state and church. Providence should not be eligible for public funding if they have different rules. And Stephen writes, I'm a Christian, full disclosure, and I firmly agree with the hospital to stand against this procedure. This is clearly a question of man's will or God's will. Thank you so much for your emails, bctoday@cbc.ca. And Sally Thorne, you said there's this lack of clarity, especially with organizations, on the issue of MAID. Might this court case, it hasn't been tested in court, but what might it do when it comes to that discussion?
Well, I think the hope of those who are launching the court case really is to move that conversation forward so that society can really wrestle with that idea of whether an organization ought to be able to have a conscience, particularly when it's receiving public funding, and whether Canadians ought to be deprived of something that legislatively they now have the right to consider. The challenge of not moving forward with these kinds of decisions is that is pushing us back from the really open and fruitful conversations that Canadians are now starting to have about their own end-of-life choices. And those are a good thing. For too long, we were a death-denying society. We did not engage fully in planning our long-term illnesses. For those individuals who have phoned with cancer, they have clearly benefited from being able to reflect on what their lives have been, what their choices are, and to be able to share that with their family. And those are very, very useful kinds of conversations. They tend not to happen if there's a sense of an organization that doesn't support that.
Thank you so much for your time.
Thank you.
And having this discussion with us. That's Sally Thorne, Professor Emeritus at UBC's School of Nursing. Let me just squeeze in one last call here from Roberta in Tsawwassen. Hi, Roberta.
Oh, hi. Thanks for taking my call. I'll just start off. I am an active volunteer at Heron Hospice Society in Delta, and we work in conjunction with Fraser Health at the Irene Thomas Hospice. And I'm going to get all choked up. It's a freedom of choice to have MAID. We've fought long and hard to have this freedom of choice in Delta, and it's Canadian right. And I think it's a publicly funded organization. Anything that's publicly funded, I think you should have a choice. As a volunteer, it's not my death. It is the person sitting in that bed's death. It's not the relatives. It's not the family's death. It is that person's death. And I've witnessed it. And many years. And I just want to make clear, this is really valuable information. The staff at the hospice do not perform the MAID. It is a specialized team that comes in, and oftentimes we're not aware of it unless the patient or client discusses that with us. Oftentimes the nurses, it's very, very, very private and a sacred exit.
Roberta, if you can just remind us as well, because this was a case by which this was a Delta Hospice Society, is that correct?
Yes. Yes, and we formed Delta Hospice Society did not comply with Fraser Health's wishes on their property. So Fraser Health gave them 1 year notice to vacate the facility.
And it terminated that service agreement last year.
Yes.
Okay. And now it's opened.
It took some time,
okay.
But we formed Heron Hospice Society of Delta. And we work in conjunction and provide many, many services, and in fact, more services than Delta Hospice ever had.
Okay.
A former director was on the board, and he's a volunteer now, and he's just blown away. This is a public, community-built place. Okay. And I just think there's no room for discrimination. And if you don't want to go have MAID, then go to a specialized area. If we're providing funds, it's someone's choice.
Does it, again, we're talking about rights here, to have to move as well if you do oppose MAID, does that also somehow violate rights on that
well,
end?
I guess, are you asking, like, if somebody is opposed to MAID, then I guess I don't know, they have a right to go where they want, but there's facilities that, it's a right. And I think it's very similar to an abortion issue in that we all have our own faith. And I have spirituality, but it's not my death. It's not, and this is what I think that we have to look at is those people that are in need. It's their choice where they want to go.
Roberta, thanks for reminding us of that case that took place in Delta. Thanks for calling in.
Thank you, and thank you very much. Okay, bye-bye.
That's Roberta calling us from Tsawwassen. 12:35 now, Pacific Time, and time for a CBC News Update. And here's Rob Zimmerman.
Good afternoon. A crowd has gathered outside the Indian consulate here in Vancouver to mark 1 year since the killing of Hardeep Singh Nijjar. The Sikh activist was shot to death in the parking lot outside the Guru Nanak Gurdwara in Surrey. Prime Minister Justin Trudeau has said there was evidence the Indian government was involved. Homicide investigators are looking for witnesses or camera footage after a fatal stabbing yesterday in Burnaby. RCMP say officers responded to a report of a stabbing along First Avenue at around 6:15 in the evening. There's no word on a possible motive or arrests. And the province says it's another step closer to establishing a kidney care centre in Surrey. Premier David Eby says a business plan has been approved for a new hemodialysis unit at Surrey Memorial. Construction is set to begin in August. And now the forecast on the north coast, a mix of sun and cloud this afternoon with a high of 14. Highs up to 19 with some sun and cloud in the Peace. In the central interior, including Prince George, some sunshine with a high of 19 as well. Highs to 18 degrees with a mix of sun and cloud in the Kootenays. In the southern interior, including Kelowna, a high of 18 with some sun and cloud as well. And for Metro Vancouver, Greater Victoria, and the Fraser Valley, lots of sunshine this afternoon with highs to 19. That's your CBC News update from Vancouver.
Thanks so much, Rob. Rob Zimmerman in the CBC Vancouver newsroom. We were taking your calls on this lawsuit that's being launched against Providence Health Care and the province of BC over MAID policies. And Basil is joining us from Port Coquitlam. Hi, Basil.
Yeah, thank you.
Yes.
Yeah, the kernel of the Christian faith, the Jesus' teachings, the whole thing, everything he taught relies on love. With 1 Corinthians chapter 13 talks about love. And if we do not have love, we have nothing. And that's what it sums up at. We don't. And so love is the crucial activity that we should be doing as Christians. And because you've got, and he was so upset with people that have the rules and regulations. And these are rules and regulations that do not relate to the Christian faith about, we as a hospital can't do it because it's against our religion. Love is what people need to have as a Christian. And so the most loving thing for this lady is to say, forget our rules and regulations. What's the most loving thing to do for her? We'll give her MAID if she needs it and wants it. To have an organization like a St. Paul's Hospital to turn people away because of rules and regulations instead of the love and faith, in Jesus and what he taught about us as the most kernel of the Christian faith is love, they're not following the Christian faith at all.
Thank you so much for the call, Basil. That's Basil joining us from Port Coquitlam. And again, we did reach out to the Archdiocese of BC and have not heard back. But a statement last year said they unanimously and unequivocally oppose the performance of MAID within health organizations. One more call on this. Certainly a lot of people have something to say, and James is on the line at Spence's Bridge. Hi, James.
Hello. I look at this court case of potentially reducing the number of healthcare beds in British Columbia. If Providence is prosecuted or whatever, they may decide to shut down instead of offering MAID in their facility. And there may be other facilities in British Columbia in the same boat. I think if the government has entered into a contract with Providence to offer specific services, they should honor it. People should respect that. We don't need to play around with reducing health care, I think, at this particular time. So there could be negative implications, and it could actually result in more deaths if healthcare facilities shut down because they don't want to offer MAID or something like that.
James?
That's my perspective.
Thanks so much for sharing your perspective. Good to hear from you again at Spence's Bridge. That's James calling us. And if you'd like to share more of your thoughts, our email address is bctoday@cbc.ca. 12:39 in the Pacific time zone. Well, my next guest argues social connection is critical, but it's also not that easy, as you may know. Vancouver-born author Cassie Killam is a social scientist and author of The Art and Science of Connection: Why Social Health is the Missing Key to Living Longer. She has some good practical tips and habits you can pick up to feel more connections with more people. And we have 2 copies of her book to give away to 2 of our callers. We're asking you on the open line, do you find it hard to make friends in your city or in your community? You can call us at 604-669-3733 or 1-800-825-5950. You can just hit pound 690 on your phone as well, or email bctoday@cbc.ca. And Cassie Killam joins me now. Hello.
Hello, it's so great to be with you today.
Very good to make the connection. I've got your book here with me, The Art and Science of Connection. It is a bit of an art, isn't it? And a science. We're hoping to pin it down. How do we reach
It is
out?
both an art and science. Absolutely. It takes both skills.
Well, tell me about that. Why do you think it's so important, first of all, to make social connections?
Absolutely. So decades of research at this point have proven time and time again that our sense of connection, our sense of community is so much more than just about making us happy. It actually influences our risk for disease, affecting things like our chances of developing heart disease, stroke, diabetes, dementia, and other conditions. And at the extreme end, how connected we feel over time actually influences how long we live. So connection is not just a nice to have, it's truly an essential part of a healthy, long life.
Now, I know that you went off and trained at Harvard in social science, but you actually have your roots here in Vancouver.
I sure do.
I don't know how long you stayed here, but I don't know if you're familiar with the reputation we have here as a place that makes it hard to find friends.
I sure am. I was born and raised in Vancouver. All of my family is still in Vancouver. It's the most beautiful place. I loved growing up there and consider myself very fortunate. You're right, though. One of the things I'm proud of being a Canadian living abroad is that we in general have a reputation for being friendly, but it's also important to go beyond just being friendly and the niceties and making sure that collectively as Canadians, we're going deeper and being truly kind and caring and connecting in a more meaningful way with the people around us, with our friends, with our family, with our coworkers, and with our neighbors.
What can make that hard?
Well, I think we can all identify different challenges in our own day-to-day lives. And one of them is just being busy, right?
Yeah.
We're all busy with our work, with our jobs, taking care of our families, paying the bills, getting chores done, getting errands done. And the pace of modern life, especially with technology nowadays, can make it seem like there just isn't time to see that friend or talk to that distant family member over the phone. And yet, what we see in the research is that it's so important to make time for that, and that even simple gestures that don't take a lot of time can actually go a long way. So, for example, studies show that even sending a simple text message saying, "Hey, I'm thinking of you, I hope you're doing well," or expressing gratitude in a simple way, right? So telling someone something you appreciate about them or something they did recently that you are grateful for. Simple gestures like that can actually make us feel more connected and deepen our relationships. So it doesn't have to take a long time in order for us to sort of exercise our social muscles and feel more meaningfully connected.
Okay, so time can be a deterrent. I know you have some tips as well for short ways, and just like you said, send a quick text, just to be able to feed that need for social connection. Cassie Killam is with me, author of The Art and Science of Connection, and we're asking you, do you find it hard to make those connections where you live in our province? Do you agree with that reputation Vancouver has, that it's hard to find friends here? Give us a call, and if you have any tips, how do you make those connections yourself? 1-800-825-5950, 604-669-3733. You can hit pound 690 on your cell phone. And our email is bctoday@cbc.ca. And Cassie, what do you count as a meaningful connection? Does it necessarily have to be with someone we live with, a romantic partner if we have one, a close friend, or can it be the interaction at the grocery store with the cashier?
That's a great question. So, the research shows that it's really valuable to have a variety of interactions and relationships that you're drawing from. So, yes, we vitally need those deep one on one connections with close friends and loved ones who know us well and who we can share more vulnerable parts of our lives with. However, even something as simple as a friendly exchange with a barista, smiling and waving with a neighbor, even those gestures as well can help us to feel part of our community and to feel like we belong. So we really shouldn't underestimate the importance of just warm, happy interactions on a day-to-day basis. Even if they are a little more lighthearted in nature, they can still help us feel connected. So it's really a balance of both and just making sure that you're being intentional in each of your interactions.
Okay, I do have a reputation among my family as being the one who just chats it up with with anyone. Like I'm watching my son's basketball game and suddenly I'm friends with a parent sitting next to me. So maybe it's a little much. I don't know. But I do find that they do feed me in some way. You know, if I have just had that you're right, that sort of amusing interaction with someone. Someone made a funny joke just as I was, purchasing something at a store. It's a little story I have to tell my family when I get home.
I love that. That says a lot about your personality. It's actually interesting. I explore in the book this notion that we each have different preferences and habits
Yes,
for
it's true.
the amount and type of connection we enjoy, right? And so it sounds like you're a little more extroverted. I actually describe 4 different sort of personality social health styles that each of us tend to fall into based on the amount and type of connection that we like. So it really does vary person to person, right? Those interactions might feel really fulfilling to you and come naturally to you, but to another person, they might, seem a little bit more daunting. And that's okay. We can each lean into our strengths and then also push ourselves a little bit
And
because
there
the
are
research shows that.
Pardon me, go ahead.
Yeah,
Yes.
go ahead. No, it can be beneficial to push a little bit beyond our comfort zone now
Right.
and then. So I love that you're out there doing that.
Well, there are times too, absolutely, when you want to just kind of have your alone time. And you're right, people have different personalities and different boundaries. Can you still make those social connections and be fulfilled, have social health, if you consider yourself more introverted?
Absolutely. I don't want anyone to come away with the conclusion that being socially healthy means you have to socialize all the time. I, in fact, am an introvert, which means that I really crave and need a balance of socializing and solitude, right? For me personally, it's important to have alone time where I can recharge my social batteries. And so really it's about finding the right balance for you, listening to your own needs, and making sure that you're getting connection in the ways that feel fulfilling to you. So for sure, definitely, if you're someone who likes some alone time, that is okay. That is part of being socially healthy for you.
That is absolutely okay. And, we are expected to be on all the time now, too, what with social media and all of that. We're giving away copies of Casley's book, The Art and Science of Connection, and you can get one by calling us and letting us know. Have you found it hard to make friends in your city, where you live in the province? 1-800-825-5950. Perry is on the line from White Rock. Hi, Perry.
I didn't realize I'd get a book. This is fantastic.
You do.
This is great. Hey, I was born in Vancouver, coincidentally at St. Paul's, not that that matters. And we moved away when I was super young. And we lived all over the country because of my dad's work and like different provinces. And then for work, my own career, I've lived all over Canada in all kinds of towns and cities and then traveled throughout Canada and the United States. And I'll tell you one thing. I was so grateful to move back to Vancouver 3 years ago, after all these years. The weather, it's going to be so fantastic. I'm living in White Rock. And I have never met so many uptight people in my life.
Oh, no.
No, honestly, I came here thinking, smoking pot aside, I just came here assuming BC people, nuts people in Alberta all think this, they're so laid back, they're a little out of touch, they're all a bunch of hippies. But, I came here, and honest to God, if you're standing at a light, and a guy standing next to you, and you say, hey, nice day, they look at you like you're going to steal their wallet.
Oh, no.
I mean, it's insane. and seriously, like, first thing I did when I moved here is I bought a barbecue, because that's what you do. You go to, hey, you want to come over for barbecue? Oh, God, no. Like, it's like you're going to invite them over to freeze them in the basement.
You sound so friendly, Perry.
I am. But the funny thing is I find overall, I'm sorry that I'm putting a big, hail over everybody. But I honestly, of all the places I've ever lived or visited, even when I used to come here for business, Vancouver is by far the least friendly.
Oh, dear. I'm sorry to hear. Is there anything that could help, do you think?
About that, too, is because I expected it to be worse in Quebec, because we dealt with a lot of people from Quebec, and, they can kind of, on edge. And even they're friendlier. It's just crazy.
Perry, I'm sorry that happened. People should just be able to say, yes, it is a nice day. Thanks so much for the call. I welcome you. That's Perry at White Rock, and Keith is on the line in Vancouver, too. Hi, Keith. What are your thoughts on making friends?
Yeah, I've got a lot of thoughts on this. I guess I have a bit of a different experience than Terry. I'd say 95% of the people that kind of I acknowledge walking down the street, or certain areas are more friendly than others, but I acknowledge them, and I'd say a solid 95% will usually look back, and you do get the odd one.
Yeah.
If you're at a traffic light. Also, Terry, please give me my wallet back. I'd appreciate that. And the thing is, I realize you're not going to get everybody. I really think it's a solid 90%. 95% that will acknowledge you. Might not be a big conversation, not that everybody wants that.
Sure.
The other thing I've realized is that I was, percentages again, I was doing a little thing. I was literally giving away free ice cream and free beer on the bike route one day, and only about 10% of the people stopped. The ones that did were mostly moms, dads, and kids.
Sure.
Beer for the parents, ice cream for the kids. And only about 10% stopped, and most of them had earbuds in. They had no idea what I was saying.
And why did you want to do that?
I'll be honest, part of it was a Vancouver Foundation grant.
Yes.
I had the free ice cream, and then I know a brewer, so I ended up with a bunch of beer, and I put it on ice and just randomly gave it out to people. And the people that stopped, I didn't put up a sign or anything. I didn't want to kind of advertise. I wanted the people that wanted to stop that were going to stop. You know what I mean? I didn't want to.
Right.
But yeah, it was just super fun, and people were great and appreciative, and that kind of thing. So I had the Vancouver Foundation, not for the beer, but for the ice cream, and that Vancouver Foundation is amazing for that. The social interaction. I see all kinds of things popping up.
That's true. That is something they work on. Yeah.
Yeah, it's amazing. Yeah. And last one, I came up with what I call the JCI, the Jumper Cable Index. I used to kill the battery on my classic 95 Civic years ago, probably every 2 months. And I've learned that if you put the jumper cables on the vehicle, kind of dangle them in the air in Vancouver, I think the longest I waited was 4 minutes.
You'll be very popular.
So the friendliness angle, I guess that's more helpful. But of course, the electric vehicles, I understand you have a very large battery in there, but you can't give a boost to a vehicle. But people will stop, and people are friendly if you,
Keith,
make the effort, kind of thing.
Yeah, really good. If you take those earbuds out, thank you very much. I think we're getting the extra.
My wallet back, Terry.
That was Perry, but I think that both of you. We're getting calls from the extroverts here right now. In fact, I think our next caller is one as well, and Rustika is joining us from Surrey. Hi, Rustika.
Hi, how's it going?
Good. Thanks for calling.
Yeah, I was listening to the segment, and I was like, I have to call.
Why?
It resonated so much with me. So I've been here since 2018, summer of 2018.
Mm-hmm.
It's been 5-6 years now, and I met so many people. But you know what? I still don't have a core group of friends. I know a lot of people. Don't get me wrong. I have people I can kind of call friends, but I do not have. It feels almost like. We are on the outskirts of all the groups of people I have met.
Right.
And it's a very unique phenomenon. I have been to many. I've lived in 11 different places in the last 11 years. That I have been in North America. I've been in North America for 14 years now.
Yeah.
I've lived in New Jersey, Missouri, Singapore, Toronto. Nowhere else I've seen this kind of behavior. It's
oh my goodness! Why do you think that is? Just quickly, Rustika, why do you think that is?
I think it might be like a combination of just the lifestyle here and like the outdoor availability of things to do. So people just have different priorities, number one. And I think a lot of people who are here already have people here, like family, friends. So many times it's happened that I've reached out, tried to make a deeper connection, only to find out, oh, they already have like 2-3, set people in their life that, or families that they don't want to like explore or expand their boundaries. They just don't have the bandwidth. And I'm yet to find, like I said.
I love your call, Rustika. Thank you very much. I've heard that a lot. I hope that you get to find a core group.
Or we move to Ontario, who knows?
I hope not. I hope not. That's Rustika in Surrey. I want to get one last question here to Kathleen. Judy is calling us. We'll give you a copy of the book, Judy, but you had many good friends. Many of them have passed away. And we also have an email from Elizabeth who writes, I'm finding it hard to make new friends. Some of my friends have passed away. There are places to go socialize, but then it's home alone afterwards. Any suggestions to help seniors? I think this is a really good question, Kathleen.
Yeah, absolutely. And first, I want to say that you are not alone in feeling that way. So many people of all ages, older adults, but also the research shows younger generations too, experience times of feeling isolated or lonely and going through a life change where perhaps you've retired, you're getting older, some of your friends are passing away, and loved ones may be moving to other places. That can be a really challenging time for our social health. So my heart goes out to you, and there are steps that you can take to address that. One of the recommendations that I love, because it's tried and true in the research, but also in the stories of people who I encounter all the time through my work, is to volunteer. This is a way to make new friends, start to deepen your connections in your local community, and feel a sense of purpose and engagement around a cause that you believe in. So whether that's, volunteering with a local nonprofit around a cause you care about, or volunteering at a school to mentor younger kids, things like that, something that you feel called to do as a way to meet new people and connect with your community. So that's one suggestion. There are many more in the book, The Art and Science of Connection.
And you'll get to read that, Judy. Thank you very much. What a great topic that you've tackled here in your book, and really practical suggestions too. Thank you so much for your time.
Thank you. It's an honor. Thanks so much.
That's Kathleen Killam, social scientist and author of The Art and Science of Connection, Why Social Health is the Missing Key to Living Longer. And we have an email here as well from Jessica, who writes, I work full-time Monday to Friday.
Thanks so much, you too.
With a child and pets at home. Quite a challenge often to find the time to connect with friends when the weekends often consist of chores, errands, and family time. Something that's helped is joining a gym. It has many benefits, including physical activity and connection with others who also attend the gym at the same time. Thank you so much for that. BC Today at cbc.ca.